The M23 rebel movement in the DRC has declared a ceasefire, expected to take effect today following intense fighting with the government forces. ICRC Regional Africa Director Patrick Joseph says the organization welcomes the ceasefire and hopes it paves the way for dialogue.
It's a welcome announcement so that we be able indeed to put systems in place to have the humanitarian situation be addressed correctly. Other organizations who have unfortunately left be able to come back if possible, and indeed to have a space for dialogue of what will come next.
In the meantime, millions of civilians remain displaced and are struggling to survive amid ongoing armed conflicts. Overcrowded hospitals and collapsing healthcare systems and infrastructure continue to worsen.
Hospitals, as per the Ministry of Health and the organizations on the ground, we all know that over 70% of hospitals in Sudan are out of function, or probably functioning with less services than the usual, simply because they've lost human resources, money, material. And again, I invite you to envisage what does that mean on a scale of a country that has no capacity to deliver medical aid. And again, that is a death warrant, a death sentence for the sick, for the wounded, to be treated correctly as per the norms of our values and our shared humanity.
Yusuf says there is a need for absolute action and solutions to combat the crisis the continent continues to face.
I think there must be resolute actions and a lot of much more attention from the media and from politicians, from the African Union and other entities to truly find long-lasting solutions. I think in this day and age where technology is advancing at light speed, it's just counterintuitive to say we're at war, and war is indeed the definition of a potential out of crisis.
Meanwhile, the SADC chair and the East African community are set to meet on Saturday to discuss the way forward in resolving the conflict in the Eastern DRC. Bonolo Maribe, SABC News, Johannesburg.